which we can use to remove the precancerous lesion. So here now, what is the importance of early detection? Here, that is the focus of today's discussion, is early detection, and we can call it screening also, by screening also, and other procedures. So we have to know the importance of early detection. If a cancer is detected at an early stage, there is a chance of full recovery, and it also reduces the deaths from cancer. So early detection remains the most important part of cancer management, cancer treatment. So how we can, and here the importance of cancer screening is there. So what is cancer screening? Cancer screening, if we put it in simple words, we are actually looking for a disease in apparently healthy individuals. We are checking for signs in a person who absolutely does not have any signs or symptoms of the disease. So it can be done by any blood investigation, any urine test, or imaging, and there are certain special screening tests based on the individual cancer and individual predisposition to cancer. What are the goals? Now here we will be talking about the goals of cancer screening. Why is cancer screening important, and what is the role of cancer screening in reducing the number of deaths and morbidity to the patient, and also the financial burden on the family. So cancer screening is actually known to, it has a very important impact on the number of deaths from the cancer. So it reduces the number of people who die from the cancer, or if we can actually prevent deaths from cancer altogether. And it is also known to reduce the number of people who develop the disease. So even before a cancer is completely formed, before a cancer is formed, we can remove the precancerous lesions, and so thereby preventing the cancer to develop. Here we can also discover a cancerous tumor before it spreads, before it grows to a bigger stage and it spreads further. So that is metastasis. Screening, when we talk of screening, we have to emphasize on what tumors we have to focus on screening, because there are lots of, like we already discussed, that there are many types of human tissues which are known to get malignant, which are known to produce cancers. So that would be focusing on each and every tumor would be impractical. So here we have to focus on screening on the most prevalent cancers, which are occurring in male population and female population as well. So here it is very important to know what are the most important cancers found in male population. So oral cavity cancers in male remains the most common cancer found in Indians, largely because of tobacco use of tobacco chewing in the form of either chewing tobacco or smoking tobacco. So oral cavity remains the most common cancer which is found in Indian male population. Second in the list is lung cancer. That is the second most common cancer found in male population, again largely because of smoking habits. And then remains third, stomach, and then GI, the intestinal cancers, colorectal cancer, and esophagus, the food pipe cancer. In female population, when we talk of the female population, breast cancer still remains the most common cancer in Indian females, followed closely by cervix cancer and oral cavity cancer, lung cancer, and stomach also, which is equally common in female population also as it is in males. So these are the common cancers where we will be focusing. We usually focus our screening test based on these most common cancers. Here next what is important to know is, I'll be just giving you a briefing of how we can target each of these most common cancer, and that is the whole point today. The screening test, what are the screening tests what we can use in each of these cancers. Talking of ladies first, breast cancer, as we already discussed, remains the #1 cause of cancer in ladies in India, and it accounts for 27% of all cancer among ladies. That approximately 1 out of every 4 cancers is breast cancer. Screening methods in breast cancer is the most popular is mammography, and it is a very simple test which can be done on an OPD basis. Hardly the procedure takes hardly 15 to 20 minutes, and it is a type of X-ray which is specifically designed to view the breast, and any abnormal growth in the breast or any irregularity in the breast can be picked up by mammography most of the times. And it is highly recommended for all the ladies above 40 years of age who to get a mammogram done at least once in a year. Next is clinical breast examination. Clinical breast examination is done by your doctor, a medical professional, who looks and feels for any changes in the breast, be it the change in size or the shape. And it is very important, at least recommended, at least with mammography once in a year, at least should be done. Then breast self-examination remains still the most important in this category, because 90% of the breast tumors, they are picked up by the ladies themselves. So during this examination, a woman looks and feels for changes in her own breast. And if she notices any change, she should see her doctor. And this is the idea is to make to be aware of your own breast, the feel, the change, anything, the size and shape of the breast. So if any change is noticed, that should be brought to the notice of your doctor. MRI testing is helpful in certain cases who are at a higher risk of breast cancer, especially with the familial predisposition. So just in summary of breast cancer, all the ladies who are above 40 years should be screened for breast cancer. And for this, at least in a year, a mammogram is advised with a clinical breast examination. And above the age of 20 years, all the ladies should have a self breast examination which is recommended every month. Second most common cancers which is found in ladies is the cervical cancer. Cervical cancer is the second most common cancer among Indian women, only to be just following the breast cancer. And cervical cancer is a major cause of cancer death in Indian women. So as we know that cervical cancer is the tumoral growth of the lower part of uterus. And what is the most important thing in cervical cancer is to know that before turning into a fully malignant growth, there is a long phase of precancerous lesions which are known to exist in cervix before it turns into a full-blown cancer. And this precancerous phase is very long, and we have a Pap test to detect that precancerous phase, which is a very important test. A Pap smear, a very simple, quick and painless procedure, which can be done by your doctor, your gynecologist, on an OPD basis, and the procedure hardly takes 10 to 15 minutes. So PAP, in what we do in PAP test is we just take the sample, we collect the cells from the cervix, and we examine these cells for any abnormal changes in them, which could be a pre-cancer stage or which is further going to turn into cancer. So PAP test remains a very valuable tool to detect cervical cancer in early stages. For cervical cancer, next thing is HPV testing. This is a virus, the human papilloma virus testing. Why it is important is here, it is because what is important to know here is that more than 90% of the cases of cervical cancer are related to HPV infections. So cervical cancer remains a standard example of how long-term chronic infection could lead to cancer formation in the late stages. So if these changes are picked up early, we could prevent from cancer formation altogether, or we can detect cancer at an early stage before it turns into malignant or metastatic stage. So here again, the cells are scraped from women's cervix. They're tested for HPV infection. And here prevention is how we can prevent HPV testing. That remains the underlying basis of HPV vaccination in young children, girls and boys. for in boys in male population for other cancers, in female mainly for cervical cancer. So here prevention is as easy as a simple vaccination, the vaccination schedule, which we can discuss later. So at this test, HPV testing can also be combined with a pap test, and that is called as co-testing. That can be done every 5 years. So who cervical cancer, who we should be screened? So anybody who is above the age of 21 should be screened for cervical cancer with a pap smear, and HPV testing can be combined after the age of 30 years. So pap test alone is recommended at least once in 3 years. So a pap test should be done once in 3 years for all the ladies who are above 21 years of age. So here, how you can seek expert medical advice about when can the screening be begun for cervical cancer, how often one should be screened, whether you want to go for a pap smear or along with the HPV testing, the co-testing, which is done. Co-testing is recommended every 5 years. Pap test alone itself is recommended every 3 years. And you can also discuss with your doctor when can we discontinue cervical screenings. Next, among the most common cancer is the colorectal cancer, which remains a common cancer in both population, male and female as well. Colorectal cancer is the cancer of human intestines, the large intestines. And in this category, we have the first test, which is very easy and can be done on annual basis, yearly basis, is testing of feces for blood, for passage of blood. That is fecal occult blood testing, and this is to find blood in stools, which normally cannot be seen with naked eyes. And this test is recommended at least once in a year after the age of 50 years in an average risk individual. Next test is a special X-ray with a double contrast, that is a double contrast barium enema, which can be taken. Rectal examination is done by the doctor, who feels the rectum for any hard growth or tumoral growth, any abnormal lesions in the rectal area. Then stool is tested for DNA from a person's stool to look for cancer. Next is the sigmoidoscopy. Important to know is that there is a thin lighted tube which is inserted into the rectum and proceeded up to the lower part of the colon, up to the sigmoid colon. And the lower part of the colon and rectum is examined for any abnormal growth or any abnormal lesion. Colonoscopy is an extension of sigmoidoscopy, where a longer tube is inserted into the rectum which is connected to a video camera. This is to look for cancer or polyps, early cancer lesions in the entire colon. So these are a few tests which can be taken up. You can have a discussion with your doctor, with your gastroenterologist, who can screen you for colorectal cancers, or your oncologist or gastroenterologist. So colon cancer, anybody who is above the age of 50 should be screened for colorectal cancers. And if there is a strong family history of familial cancer, if there is a familial predisposition to cancer, the age of screening can be lowered. So the frequency of testing remains as such. A stool blood test is to be done on an yearly basis. Sigmoidoscopy is usually done on a 5-yearly basis, once in every 3 to 5 years. Colonoscopy is taken after every 10 years. Double contrast barium enema can be done ranging from 5 to 10 years. Next, most common, which is the most common in male population, are the head and neck cancers, the oral cavity cancers. So here, in head and neck cancers, if somebody is noticing any abnormal lesion in the oral cavity or a nose or throat, any problem in swallowing, any ulcer which refuses to heal, or any growth which is growing with the time, that should be brought to notice of your doctor, who looks in the nose, mouth, throat for any abnormalities and any lump in the neck. So here, equally important are the regular dental checkups, which is to screen for head and neck cancers. Lung cancer, largely due to smoking. So chronic smokers, here screening, we are selecting, we have a special population for cancer, lung cancer screening. Those who are long-term chain smokers, they are subjected to CT scan, which is a low dose CT scan, which can be done to detect early lesions in the chest before turning into malignant or before growing into bigger stages. Next most common, amongst the most common remains the prostate cancer, especially in elderly population. So here the doctor does the rectal examination, which is called as a digital rectal examination. And your doctor examines the rectum to feel the prostate gland for any abnormal area. And this can be digital rectal examination, can ideally be combined with a PSA test, that is a prostate specific antigen test. Here, PSA test is a simple blood test, which is done only in OPD, on a OPD basis. And here, if the levels are high, that the higher levels does not necessarily means that you have prostate cancer, but it should be looked for further. It calls for further investigation. So anybody who is above the age of 50 years can discuss about the risk of getting prostate cancer with your doctor, along with getting DRE, that is a rectal examination, and annual a yearly PSA test. Here, important in knowing about prostate cancer is that often in initial stages, it may not have any symptom. So if picked up early, it can definitely prevent cancer from spreading and later on progressing to bigger stages. Next image is skin cancer. Here a complete skin examination is done by the doctor, and self examination is equally important. A mole examination or dermoscopy, in which the lesion is examined for any changes in size, shape, and pigmentation. So we all know, we have already discussed about the benefits of screening, how we can screen apparently normal, healthy individuals for any cancer who can be found in precancerous lesion or in early stages. So benefits, we already know that it amounts to a complete cure with less morbidity and less financial burden on the patient and the family. So, but there are certain risks also which are attached to screening. Here we are going to discuss that. So cancer screening has certain, most common out of these remains the overdiagnosis. So here some of the slow growing tumors which otherwise are not going to cause any harm during a person's lifetime, but they are picked up on screening, and they might the patient might have to undergo further evaluation and treatment for same. Then there is a very small risk attached, that is false positive. We may have a false positive, but that always have to be false positive. Reports have always to be confirmed with the proper diagnostic test. So we can reduce the false positive rates by using that. False reassurances, screening test turning negative in people who are in person who actually have a cancer, underlying cancer. So this can be tackled by a regular follow-up, depending upon your discussion with your doctor, which may be monthly or 3 monthly or 6 monthly. So a regular follow-up visits can take care of all these the harms of screening that can be done. So here the purpose of today's discussion has been to be aware of what type of cancer should be screened for, what are the tests which can be taken up to screen for a specific type of tumor, and what age should the screening begin, and how often these tests should be done, and what should be done if screening shows positive results. So this is about raising awareness of this disease, which remains still highly neglected in the society among the masses, and it should be talked about more often. Should be talked about more and more about what are the most common cancers which are known to occur, what are the tests which we can offer, and how frequently we should be tested, and what should be done if these tests come out to be positive. So you can always talk to your doctor about your personal risk of developing cancer, because a proper screening schedule can be formulated only based upon your age, your gender, your personal and family medical history, which is very important. So it is awareness is the key how we can handle this menace. The second most common cause of death, which still remains very important cause of death in India. So awareness is the key, and if we remain aware, it can be detected early, the disease can be detected early. That is the whole point of today's discussion, and we will continue spreading this awareness. Thank you for today's session. Stay aware, stay healthy, stay safe. Thank you.